going to talk about evidence for environment and health policy. And this is clearly a really important aspect of the work of the centre, and has been sort of since the outset, really, since we started 10 years ago. And our work has sort of been interacting with policy and related partners throughout on a really wide range of topics. This is just a very small selection of the kind of work that's gone on in the centre relating to policy and things that we've fed into. But today I'm going to talk about how we do that and a couple of key examples, as Emma said. So there's lots of different ways in which we interact with policy worlds. This is just kind of a summary diagram, really, of how we do it. So it's not simply about us generating evidence and then passing it over and saying, here you go and do something useful with that. It really involves us being involved across the policy spectrum, throughout policy cycles, and being involved across the work of the centre on a real sort of diversity of issues. So, as I said, I'm going to focus on two key bits of work from recent years. First of all, the WHO work on nature, biodiversity and health. And then second of all, the Chief Medical Officer's annual report from this year. So the WHO work, first of all, 2 years ago, the centre was designated as the WHO Collaborating Centre on Natural Environments and Health. So it's a real sort of recognition of the work of the centre in this area. And the first substantial piece of work that WHO wanted us to do for them was this overview of the connections between nature, biodiversity and health. So I'll just credit here Becca Lovell, our colleague who produced these slides, and I've adapted them a little bit here. So the challenge here really is to communicate the key issues around biodiversity and nature and health to the 53 member states of the WHO European region, and especially to make that information accessible to Environment and Health Ministry officials. And really it needed to meet different needs. So it's kind of a call to action for those that are currently inactive in this area, but also trying to make it useful for those ministries and nations where they're already doing stuff on these kinds of linkages, but to try and give them some useful resources. And just to highlight that the WHO European region is the blue area covered here, so it's not just continental Europe or the EU, it's a really sort of broad mixture of different countries. How do we do this kind of stuff? Well, we had a very short time to produce this report, especially including the WHO review processes that these kinds of things have to go through. So it wouldn't be possible to do this without the willingness of colleagues and a lot of pre-existing knowledge. So really capitalising on that kind of bedrock of evidence and knowledge that exists in the centre, and the willingness of our colleagues to chip in their expertise and their time to make it happen. So the key bits, I'm not going to go into too much detail about what's in the report, but really it kind of summarises how nature is a really vital support system for human health. It's not just a nice to have, it's not just David Attenborough documentaries and so on. It's actually a really fundamental thing for our existence, and we are mutually dependent on each other. Nature also contributes to our quality of life in many different ways, and many of you that are familiar with the research carried out by the centre will be familiar with some of our research in these kinds of areas. But also critically, if we fail to protect nature, then that threatens our health and well-being. So sort of doing nothing here is not an option. We have to be proactive, we have to act to protect nature, because otherwise we don't protect ourselves. So the report kind of covers a range of different topic areas. So it covers some of the sort of positive sides of things, like how access to green and blue spaces can be good for our health, but also how nature helps us to mitigate air quality, how it's fundamental for soil and agriculture and our food systems, how it helps to regulate infectious diseases and so on. and the issues around antimicrobial resistance in the natural environment, especially, and how we might be exposed to that outside of healthcare settings. So a real diversity of issues that are raised through the report. Towards the end of the report, we get into the economic value, and you've already heard in the film some comments around this that Lewis was talking about. And clearly it's really important that we think about the real economic values of nature and biodiversity for our health, and how it underpins our livelihoods. It reduces burdens on the healthcare system, and these wider kind of intangible benefits of biodiversity and nature for our human systems. So towards the end of the report, we make some we hesitate to call them recommendations, because guidance issuing from the WHO is very complicated, but at least there's some actions that are recommended for anybody working in this area, particularly those health and environment ministries across the 53 countries. First of all, that we need integrated policies and commitments across sectors, and that's something that happens really well in some countries, really doesn't happen at all in other countries. So integrating our approaches to the environment and health, recognizing that there are co-benefits, and coming up with strategies and ways of working to realize those co-benefits for people in the environment, building on capacity and skills, building it around education, research, evaluating what's happening, really important. Underpinning our sort of sustainable production and consumption using financial tools and interventions, going back to the economic kind of issues that underpin everything, really. And really importantly, actually understanding and acknowledging the consequences of inaction. So that whole idea that doing nothing is not an option. We have to be proactive in order to sort of get the opportunities for nature and health from these kinds of actions. So that's a very brief whip around the WHO report, and I'm very happy to get into more detail about that, but it's freely downloadable from the WHO website, also available in Russian, and we have a sort of a bibliography that goes along with it that provides a lot more information and background to these kinds of issues. And I'll just thank again everybody that contributed to the report, because it's really a large group of people, and we couldn't have done it without all those contributions. Okay. Zooming in a little bit, coming back to here in England, so the Chief Medical Officer, who many of you will be familiar with now, Chris Whitty, decided that the annual report for 2021 would focus around health in coastal communities. The annual report of the CMO every year takes a different kind of angle, and this year the focus is on health in our coastal communities. And many of you that live, particularly here in the Southwest, but also in other coastal regions, actually around the world, will recognise that coastal communities can be remarkable and beautiful places, but often have some of the worst health and well-being outcomes here in England, but also elsewhere around the world too. So that's a really critical kind of a sort of a thought to go forwards with, that actually our coastal communities experience an awful lot of challenges. And those challenges include socioeconomic deprivation, the demographics, often aging communities, particularly in our coastal regions. Health services can be challenging to access. The economy and employment can be fragile, can be really subject to substantial changes, will have changed really substantially over the last 50 to 100 years, with particularly the loss of small-scale fishing and other kinds of relevant industries. Education can be a challenge, and also housing, and many of us, certainly here in the Southwest, will be really familiar with the challenging housing environment that's really arisen, particularly over the last year or two. And we see this reflected in the health stats. So on the right here, you have a graph from the report on the coastal effect. So the sort of excess health burden on the population associated with coastal community living. So across the board, for most health conditions, a kind of excess of these particular kinds of diseases. So it's a really challenging thing, and clearly our coastal communities warrant kind of particular investment and thinking about how do we tackle these kinds of challenges that are really entrenched and really complex. So what about the healthy blue space effect? Clearly, a lot of the research at the centre for the last 10 years has actually been about how blue space in coastal environments can be health promoting. So aren't these things kind of in conflict with each other? Well, they're not really. And unfortunately for us, while a lot of the report from the CMO focuses on those kind of different challenges for coastal public health, they asked us to produce a chapter on blue health, on the benefits of coastal living. And it's great to have that as a bit of balance in there. And the summary really is kind of wrapped up really well in this quote. Although this report demonstrates the many health challenges of coastal communities, paradoxically, coastal areas are generally intrinsically healthier. And we've shown that once socioeconomic and demographic characteristics are accounted for, people living close to the coast tend to report better health on average than their inland counterparts. So we know that probably arises through a range of different mechanisms, through the mitigation of environmental stressors like noise and air pollution, opportunities to build personal capacity, whether that's opportunities and motivation for physical activity or other kinds of things that a coastal environment allows to happen, and also alleviation of psychophysiological stress, and also sort of cognitive restoration. So those opportunities to take time out and to just be in a coastal environment, to watch the waves and to sort of get away from everyday stresses. So we have evidence accumulating in these areas. Some of it's just starting out, some of it's really quite well developed now. But there are these kind of mechanisms by which health benefits can accrue through our living in coastal environments. So what's really important in the chapter that we put together for the CMO report is these kind of these ideas of the cycles. And again, going back to the WHO report as well, thinking about how these things are all interdependent and how we can't just think of the environment and how it impacts on us. We have to think about how we impact on the environment and how this all comes around in a great big cycle and these really complex systems. And we have to think about the unintended consequences of things that we do that might seem a good idea, say, to promote human health and well-being, but then if they come at the cost of the natural environment, then that's unsustainable and no good. It's not going to do anything for any of us in the long term. So we really have to think about these interconnections between the environment and health. And that's really, as we said in the short film, that's baked into the ethos of the centre, that we have to think about this as a complex and interacting system. And so really, when we think about how the evidence that we're generating can help to influence policy, there are clearly huge opportunities for human health and environment mutual benefits with taking the right policy actions in health, in environment, in transport, in housing, across the board in the different realms of policy. And obviously I've focused here particularly on the international with WHO and the national with the CMO report. We also do a lot of work at the local level here in Cornwall with partners, the local authority, the LEP, with the health services, with NGOs and so on, and our local partners across the country as well and elsewhere. And really fundamentally building relationships and collaborating with policy partners is crucial to making the evidence matter. And I think we've all grown to really recognise that over the last 10 years. It's no good us just generating evidence in our little silo and saying, here you go, here's some evidence, go and make it useful. We have to collaborate to generate robust and relevant evidence, and we work together to package up the evidence and to communicate it so it's getting into the right places so that it really can have that influence and help to shape environment and health policy for mutual benefit.